Hi, everyone. I'm Ning Wong, and I have a 20-year-old son who is nonverbal and with very limited self-help skills. I'm actually I have a question to share from insurance point of view. The qualified Medicare beneficiary is a great program, but billing for the QMBs is making things more complicated and discourages doctors to accept QMBs as patients. Is it possible for Medicare Advantage plans to issue insurance cards for QMBs that show correct copays, which is $0, so that doctors will not insist on copays and risk possible sanctions? Can Medicare Advantage plans bill Medicaid directly for the copays? Can Medicaid automatically pay doctors using billing information from Medicare in the same way as Medigap automatically pays doctors using billing information from Medicare? These are questions because doctors will be more likely to accept QMBs as patients because they won't have to bill Medicaid on top of either Medicare or Medicare Advantage. Thank you.
Are prohibited to balance bill Medicaid beneficiaries. For these reasons, healthcare providers who want to receive full payments for services deliberately refuse to take on patients with Medicaid. Even before the incident, medical practices in Mercer County had refused to accept Monica as a new patient as soon as I told them that she had Medicaid. So it's common knowledge among those met with Medicare or private insurance, not to mention that they had Medicaid when making appointments for new doctors.
For those with IDD with multiple issues, it's nice if we can get designated places or doctors that somewhere DDD puts up on the website that says, hey, these hospitals are for IDD and these are the doctors who will see IDD. And issue is with psychiatrists too. They don't want to see everybody. So it will be nice to have a place for our loved ones to go to. Not only we families take them there, but also when we are not there, that they can continue to be taken there. That is all I want to say.
So I've asked the insurance, could she go to an Angelman's clinic, which is out of state? There's one in there's one in Boston, Massachusetts. They have a clinic in New York and PA, but there's not one in New Jersey. And every time they won't answer me after that. Usually has a coordinator with Horizon, and usually the girl gets back to me when I have questions for anything. I need some numbers. She needs a specialist or something. But for this, nothing. I've been going through this for years. So I went to another neurologist thinking maybe they could help me. No.
Medicaids. I started off on Medicaids because I disabled. I'm in Warren County now. I was in Middlesex when it first happened. I have brain injuries and I've gotten much worse. I got COVID, so I got even more new health issues since COVID. When I first started, I had Medicaids. On paper and supposedly legal, I'm supposed to have a social worker guru to help with all the wonkiness that a lot of the parents are telling you is there's gaps and it's just not working and we're all getting.
Medical Center of Excellence that was dedicated to the IDD population, where we had staff who knew how to interact from the front desk, from the scheduling people, social workers, nurses, medical assistants, physicians, where it could be a primary care home for not only kids with IDD, but also for the caregivers. And that's what we do at Risen. We take care of the caregivers as well, where we also have psychologists and psychiatrists on staff. So there's this interdisciplinary staff that is adept and well-trained at dealing with the population. It'd be so amazing if we could have one in every county. So there was like this well-known go-to center for every county.